Heart to Heart on ABC 27 is brought to you by Penn State Milton S. Hershey Medical Center.
And welcome back. Dr. Davis is here to answer another viewer question for us. I had triple bypass in May 2010. After surgery, I went for cardiac rehab where I was monitored by their medical staff. I now exercise 3 times a week at a local gym. Without being monitored, how can I feel safe while I exercise?
That's a great question. The cardiac rehab program prepared this patient to be able to exercise in an unmonitored setting. They watched his heart rate, his blood pressure, they followed him closely for symptoms, and by the time he was done, he obviously had passed that test. The only thing he needs to do now is to stay within his limits, continue to have close follow-up with his physician, but he should be fine exercising alone.
Okay, Dr. Davis, thanks for joining us, and we want to thank all the doctors here for answering your telephone calls. Once again, the lines are open until 8 o'clock. The number to call is 236-1444, and we'll send it back to you in the studio, Chuck.
Thank you, Deborah. And joining us now, Dr. Mark Kozak, an interventional cardiologist. That's a new term to me. I had to explain what that was, and tell us about, we'll talk about the Heart Alert program. See, tell me about that. How does that work?
Well, I'm an interventional cardiologist, by the way, is just a fancy plumber. But the Heart Alert program is a systems-based approach. So basically, before the Heart Alert program was put in place at Hershey, emergency room doctors, nurses, and cardiologists all kind of did their things separately. And what this program was about was integrating all those programs to make everybody work together to improve patient care.
Well, now, why did the program start? Why did you start? You had to sense a need. Did you see a need and say, we've got to tighten this up a little bit?
That's right. What happened is about 5 to 10 years ago, it became clear that the best way to treat a heart attack was to open the artery that was closed as quickly as possible using balloon angioplasty. But in order to get the benefits of that treatment, the opening needs to be done very early, within the first few hours of a heart attack. So we measured what we were doing at the time, and we found that we probably weren't doing things quite quickly enough to get the full benefits of this new treatment. So that's what made us start this program.
Now, how's the program work? Is it complicated, or is it just lining up all the ducks to make it work?
Well, I think that's the fascinating part about this, is that it's not technical. It's something that everybody watching this can understand. Is what we did is we measured each step in the process. We measured how long it took from the time that a patient arrived at the hospital until an EKG was done. We measured how long it took for somebody to interpret the EKG. And we measured how long it took for the paging operator to get in touch with the people who were going to treat the patients. And when we actually made all these measurements and totaled it up, we were kind of disappointed with how long things were taking. So we began a process to shorten each step of that system to get the patient treated in as short a time as possible.
Let's talk about some of the results from this now. How's this working out? You've had it underway 5 years roughly?
About 5 years, okay. Right. Back in roughly 2005 when we started this, and we measured what we had done in the previous year, it was taking us 2 to 2.5 hours from the time that a patient first arrived at the emergency department until we could get the artery open. By simply laying out all the steps and setting targets, we were able to reduce that very early in the program, and we made some important changes. The first change was that patients presenting with chest pains are to get an EKG within 10 minutes. So if you were to show up tonight in our emergency room, God, I hope not.
Yeah. Let's rule that out, please.
The rule would be that you should have an EKG done within 10 minutes, and it will be interpreted by one of the staff physicians in the emergency room. So that was kind of a culture change, because it empowered the nurse who was seeing the patient first for triage purposes to not wait for a doctor to give the order for the EKG. The nurse was empowered to do this without any intervention. And each step was assessed in the same way, and what we found is that there were inefficiencies at each step in the process, and collectively we were able to make dramatic changes over the period of time.
Is this something you continue to fine-tune? Do you do drills? Do you say, let's run through this again? You have new doctors, new nurses coming on staff?
That's a very important point, that as new people are hired and in-serviced for various departments, they have to be taught how this process is working. And it's an ongoing process. What we do is every patient who comes to the hospital has a flow chart which tags the time that they arrived at the hospital and the time that each step of this process has happened. And what that has allowed us to do is to continually refine that. I'd like to say that it's been continuous progress, but we've had some periods of time where we've actually had backsliding. And by continuing to do this with each patient that arrived, we've been successful at identifying the obstacles to this.
Well, thank you, Doctor. It sounds like you're making dramatic progress there. That's wonderful. Thank you, Doctor, for joining us.
Thank you.
And also thanks to all the doctors. And thank you for sharing your stories and sending in your questions. If you'd like more information, I'd like to schedule an appointment at the Penn State Hershey Heart and Vascular Institute. Call the 800 number at 243-1455 or visit online at pennstatehershey.org/heart and vascular. Thanks for watching again tonight, and as always, good health.